Thunder Bay Regional Health Sciences Center services a population of about 250,000 people, and we believe that this hospital really belongs to the community. PFCC is an acronym for Patient and Family-Centered Care, and it really is a philosophy we practice at the hospital. It's really the foundation of everything we do, and really it's about bringing patients and their families into being partners in their health care. Our strategic plan is the roadmap to our success. Our 5 strategic pillars are comprehensive clinical care, the patient experience, seniors health, Indigenous health, and acute mental health. All those combined are our strategic plan, and it really entices us to be healthy together. When you talk about delivery of clinical services, I mean, we've been doing that forever, delivering the clinical services. But when you introduce the philosophy of patient family-centered care, the delivery becomes different.
At Thunder Bay Regional, I'd like to think that we treat the disease, but more so we treat people, we treat the person.
We used to measure patient satisfaction. That was important. But we've discovered that patient experience is much broader. So we're making sure you're happy with what's going on. And at every level, sometimes it's just not the clinical care that's important. It could be spiritual care. It could be just the way a physician talks to you, and that could be so important.
Well, I became a PFA because I felt the need that the hospital in Thunder Bay needed change, and I thought my voice and my ideas could implement like a better environment.
The biggest base of population right now is the baby boomers, and you know what? We're not getting any healthier. We're getting sicker. As we age, we tend to use more health care. So it's time right now that we pour resources and real initiatives to make it better for seniors.
If we had a senior come into the hospital, let's say who had fallen down and badly bruised, and they ended up in the hospital by ambulance, and after assessment with the patient, they determined that the patient really shouldn't go home at that point in time. The idea was to keep them engaged so that when they were ready to be discharged, they would be as well as or better than what they were when they came into the hospital, so that they can go home and resume as much normal life as they can. And of course, that just makes them so much happier.
We're really dedicated to make it easier for our Indigenous patients. And you know, you have to walk the walk when you say you're going to help a certain population. So we've actually went out and engaged Indigenous communities, because you know, we can talk about what people need, but it means nothing unless you ask.
We have to be sensitive to the fact that there is a language barrier. We have to be sensitive to the fact that they may have had unpleasant experiences elsewhere when they seek health care. So we at the hospital, as Indigenous navigators, we are there to receive patients. We are there to receive their family members. We are there to offer assistance, to make them feel at home, to make them feel comfortable, and to help them understand the medical terminology.
We've come to discover, and I think society in general knows, that mental health is as important as physical health. So when we talk about a strategic pillar, we've committed that not only are we going to fix you physically, but we're going to help you with your mental health.
I think it's just sort of trying to help erase the stigma around depression and mental health, and letting people know that it's okay to ask for help.
We respect our staff and the patients and the patient's family equally. It's a partnership, and we need to be healthy together. There's nothing more important than our health. and I think everybody agrees on that. So we are healthy together.